Hello and welcome to Group 10's Flu Vaccine Podcast, featuring Richard Arnold, Suzanne Huber, Lucas Joseph, Diana Jules, Lacey Strickland, and myself, Brett Labossiere. Let us start with Lacey giving us some background information on the flu.
Influenza, commonly referred to as the flu, is a contagious illness caused by the influenza virus and is spread from person to person through coughing, sneezing, or simply talking face to face with someone who has the virus. Flu season typically peaks around January every year but can occur year-round. Anyone can become infected with the virus, but those who are at higher risk include young children and those over the age of 65. You may wonder how you can tell if you have the flu and not just a cold. The difference is seen in the symptoms. Typical flu symptoms include fever, cough, body aches, fatigue, runny or stuffy nose, and sore throat. When children get the flu, they often experience the same symptoms as well as vomiting and diarrhea. You may be asking yourself, what's the big deal? Young children and the elderly population tend to have weakened immune systems. This means that their bodies are not quite able to fight off the infection as well as normal, healthy adults. Because of this, young children and the elderly have a greater chance of death if they get the flu. The flu can be prevented through annual flu vaccinations. Last year, an estimated 79,000 flu-related hospitalizations were prevented through the use of immunizations. That's enough people to fill up an entire NFL football stadium.
Now let's talk about the different types of vaccines available. But before we do so, let's discuss how vaccines work. Vaccines work by stimulating your immune system to remember the viruses upon infection. This allows a quick response to defend the body. They aim to build your body's immune system specifically to flu viruses, with only having some expected minor symptoms of the flu, such as fever. There are two different types of vaccines which can be given: a trivalent form and a quadrivalent form. First, we'll discuss the different types of trivalent forms. The trivalent flu vaccine is a traditional seasonal flu vaccine which protects against two different type A viruses and a type B virus. There is a standard dose trivalent shot, which is grown in eggs, and there's also one that's grown in cell culture. The trivalent shots grown in eggs can be administered to infants as young as 6 months old. Those grown in a cell culture can be administered to adults that are 18 years or older. There's an egg-free form of the shot as well, and it can be given to individuals between the ages of 18 and 49 years old. There's a form that's high dose, which is intended for seniors which are older than the age of 65. Another option is the intradermal trivalent shot. This is set at a standard dose, and it's sent for individuals between the ages of 18 and 64. The benefit for using intradermal shots is that the needles used are much smaller because they'll be administered into the skin rather than into the muscle. Now we can move on to the quadrivalent form of vaccines. So while the trivalent protects against two type A viruses and one type B virus, the quadrivalent protects against two type A viruses as well as two type B viruses. There's a standard dose shot as well as a nasal spray form. The nasal spray may be given to any individual between the ages of 2 to 49 years old, as long as they have a healthy condition, which means that they have to not have any medical conditions that can increase their risk towards complications of influenza. Now we will discuss why there is a quadrivalent vaccine and not just a trivalent vaccine, and which one would be better for you to have. There are currently two different types of type B viruses that have concern of researchers, specifically in the Northern Hemisphere. Researchers have tried to predict which form of type B will be more prevalent in these past years. And many times they've been wrong when choosing which type of type B vaccine to give. The quadrivalent form removes this guessing by protecting against both type B viruses. Now the CDC does not have a recommendation whether to have the trivalent or quadrivalent forms of flu vaccines. The reason why is because there will be a shortage of quadrivalent flu vaccines, and the CDC believes that annual administration of any form of flu vaccine is more important than waiting to get the quadrivalent vaccine. Now let's hear from Suzanne Huber, who will discuss flu vaccine studies.
In a multinational random observer blind phase 3 clinical trial, the quadrivalent vaccine containing strands of influenza B in a population of children of 5,220 children from 15 different countries of a mean age of 5.4 were given the quadrivalent vaccine. The controlled group was given hepatitis A vaccine. All the others were given the actual quadrivalent. The results of this clinical trial was that the quadrivalent vaccine was 55% effective against influenza, 70% effective in moderate to severe influenza, and children had less symptoms of fever and respiratory tract infections than the actual control group. Reduced negative effect on children's daily activities, time parents had to take off of work to take care of the children, and reduced the time that they had to use healthcare resources and go to doctor's appointments. The limitations of this clinical trial were that there was only one type of flu vaccine given that flu season. And the conclusion of the clinical trial is that influenza quadrivalent vaccine is safe for children ages 3 to 8 years old in the prevention of influenza.
Diana will now discuss flu vaccines for children.
Most children only need a single dose of flu vaccine. However, it is suggested that a child receive 2 doses of flu vaccine if they had the flu before. For healthy kids, a single dose of flu vaccine is enough because the second dose will only provide a small additional protection. There are different dosage forms of the flu vaccine for children. Afluria, Fluarix, Flucelvax, Flulival, Fluvarin, and Fluzone are administered IM. Fluzone can be administered intradermally as well. And for children who are uncomfortable with needles, Flumis is an intranasal flu vaccine that can be administered from ages 2 to 49 years old. For the children who are allergic to eggs, Flublok is a vaccine that does not use the influenza virus or chicken eggs in the manufacturing process. The influenza vaccine are offered to kids as young as 2 years old. However, what about the children that are younger than 2 years old? Some suggestions on how to prevent flu vaccine in children that are younger than 2 are washing their hands frequently and staying away from people that have signs and symptoms of the flu.
Now let's talk about flu vaccines in the elderly from Ricky.
The elderly are another population that is especially at risk for flu-related complications. Patients with chronic diseases are especially at risk. 90% of flu-related deaths occur in the elderly. There is very strong evidence that the flu vaccine decreases the risk of pneumonia, hospital admissions, and mortality from the flu in elderly patients. It is recommended that the elderly get their flu shot once a year. Although a flu shot does not mean that they will develop the right immune response, many patients will mount a response and respond appropriately. A higher dose vaccine is available that may be more likely to work in patients older than 65. Talk to your primary healthcare provider about which option is right for you. For most seniors, the flu shot won't cost you anything. Because of the benefits of the flu shot, Medicare Part B covers 100% of the cost once every flu season.
Suzanne will now discuss how social media can be applied to the flu vaccine.
We plan on using social media and future podcasts to play a role in advocating the flu vaccine. We also plan on answering common flu questions and also posting banners on social media for different populations to see these answers to the questions. We're also planning on advertising facts of why people should get vaccinated. Also hosting future podcasts informing the general public about the information about the flu vaccines, the different strands that are available each year, and what is safe for pediatric and geriatric populations. We also plan on doing informative future podcasts which will introduce new technologies and vaccines for these different populations.
Now Lucas will discuss some side effects of being vaccinated for the flu shot.
Hello, my name is Lucas and I'll be talking to you guys about the side effects of getting vaccinated. Some of the side effects that might occur with flu vaccination include soreness, redness, or swelling where the shot was given. Some people might also get a low-grade fever and aches. In very rare cases, life-threatening allergic reactions can occur, and in such case, one should call the doctor or get to the doctor right away. People with egg allergy are not advised to get flu vaccines because the vaccinations are manufactured using a virus grown in eggs. Some common questions people tend to ask are, would vaccinations give them actual flu? How long is a vaccination effective for? Do they need a prescription to get vaccinated? Can a nursing mother or pregnant woman could get vaccinated? Well, the answers to those questions are that you could never get the flu from a flu vaccination. Usually, flu vaccinations are effective for 1 year and they do not need to be prescribed by a doctor. Believe it or not, nursing mothers and pregnant women can get vaccinated and can protect them as well as their babies.
Well, thank you for listening to our podcast, and please refer to the references and let us know if you have any questions. Thank you.